views of people with disabilities in East Africa. So, welcome.
I don't know if I need. Do I need to use this? Is it?
Yes. Yes.
Can you hear me now? Yeah?
Yes.
Good. Okay. My name's Rob Ailey from the UK. I'm the Programme Manager for Kenya, working for Advantage Africa, which is a small NGO based in the UK, but working in East Africa. Our core work is actually to do with community development, working with self-motivated, passionate people in their own communities, and we help to build their capacity and facilitate them to do their own development work, largely in the areas of disability and HIV, and some sexual violence work. And then we also undertake some small amount of research, and that's what one of the projects I'm talking about today. We were not actually looking to do a sexual violence project as such. We were working in the field of disability, and we were working in a project to empower and provide services for people with disabilities in eastern Kenya. But actually, out of that, we became quite alarmed about the large numbers of women and girls who were coming to us for support and after being sexually abused. There were a large number, and so we began to wonder, well, what is going on? Why is this happening? And ultimately, that's the reason why we undertook this research, and we wanted to find out the social, cultural, and institutional factors that contribute to sexual abuse of persons with disabilities in East Africa. And we were doing this from the perspective of an NGO who's used to working on practical interventions. So we wanted this research to point towards some interventions in the longer term. It was a partnership between ourselves, Advantage Africa, our local community development group, Kibwezi Disabled Persons Organisation, and the funders, International Foundation of Applied Disability Research, FIRA. I just want to introduce Agnes Masembi, who is the coordinator of KDPO, and I want you to listen to her talking about the reason for the motivation for this work. This is a little video.
Coordinator. Recent years, we had many instances of sexual abuse for persons living with a disability. We tried to seek justice, but all in vain. Because in our culture or tradition, there is this when a person is sexually abused, to exchange with some goods and a small money, and the case is solved. But we tried to seek justice with my colleagues. And I myself, personally, am threatened many times because of seeking justice for persons living with disability. And up now, we are just trying. We have not get the true or the proper justice. If we take this case to the authorities, like police and the others, they just ignore our request.
Can we move on to the next slide? So you can hear the passion in Agnes's voice there. She's been working in that community. She's been trying to get justice for survivors of sexual abuse with disabilities, and she's just hit a brick wall and too many barriers. So the motivation for our research, in summary, is the numerous experiences in the community of trying to assist survivors of abuse, frustrations with accessing support for survivors of sexual abuse, counselling, that kind of support just not being available, and ultimately failing to get any kind of justice. I don't want to talk too long about the methodology behind the research because we don't have time, but I would just say it was a small study using qualitative participatory research approach. The research team included women and men with disabilities, and we had an advisory group of local people with disabilities as part of the team. It was a very participatory approach to the research. We started the process with a literature and policies review and an analysis paper, which is available if anyone's interested. We started with the research workshop in Kenya for 5 days, and then we undertook the field data collection. Now, we weren't interviewing survivors of sexual abuse, disabled survivors. We were looking at the broader context. So we identified the support networks and stakeholders who are involved in the front line of immediate action when sexual abuse is reported. So that included, in the case of Kenya, village elders, sub-chiefs, chiefs in the local community, and in Uganda, the lowest level of local councillors, the LCIs, the clan leaders, but also community groups, disabled persons organisations. We had individual interviews with these groups to find out what their responses were to this issue. And then, of course, we also interviewed the formal authorities like the police and the healthcare services. We also conducted 9 in total focus group discussions with men with disabilities, women with disabilities, and parents of children with disabilities. We had a primary data exercise, and then we had quite an interesting mid-project workshop verifying the data with with a large number of stakeholders and participants, final data analysis, writing the final research report, which again is available, and dissemination of findings to work towards the design of interventions. Just a few highlights from the literature review. Statistically, persons with disabilities are at increased risk of sexual abuse when compared with the general population. Figures vary, but it's certainly at least as much as 3 times more vulnerable, probably higher than that. Many survivors suffer multiple violations, and many perpetrators commit multiple violations. I think that's true of sexual violence across the board. An African study of children with disabilities found that 75% of boys and 25% of girls were reported as who'd reported being raped said nothing had been done about it. Okay, one of our major research findings, or perhaps one of the most interesting ones, most incidents of sexual abuse of people with disabilities do not reach the formal justice system. They don't even reach, actually, the police. They might not even go to hospital or get any kind of health care. Why is that? Let's take an example of a girl with a disability who's sexually assaulted. We would hope that that survivor seeks support. But in reality, our research is showing that actually the survivor doesn't necessarily report it. What are the reasons for that? If you're a girl with an intellectual disability, living in poverty, or a girl who's deaf or blind, what are the barriers to disclosure? You're already stigmatised because of attitudes to disability in your culture. You're already discriminated against. Your self-esteem might be low, and then you're also subjected to sexual abuse. You feel shame, you might feel misplaced guilt. You might not believe you're going to be believed, you might not be believed, you might not be valued in that culture. You might be subject to threats from the perpetrators and their families and associates, and your communication may not be facilitated at all. There may be no sign language, there may be no facilities for you as a person with a learning disability to report to the authorities. So in addition to all the barriers that everyone experiences in this area, disabled people are critically excluded. And if you're living in poverty, just the fear of demands for money to take your case forward is a major issue. So when we look at those barriers, we have to ask ourselves, are we expecting too much for survivors to go ahead and report? Would you report something with all these barriers? Let's say you do take it. Sorry, just to conclude. So very often the survivor receives no services and no justice has been done, and the abuse may continue. Let's take an example where the immediate action is taken. It's reported to family and village elders, for example. What happens at the community level? The community itself get together and this concept of community shame came up over and over again. Communities want to keep these things secret. They don't want them coming out into the open. Very often they try and deal with these things in what we call local courts, where they mistakenly take on serious crimes and try and resolve the situation locally, which is way beyond their real remit. They come up with inappropriate resolutions. We heard about the victim and the perpetrator being suggestions that they should get married to resolve the situation. And then petty compensation is all too common. Give the survivor's family a goat and everything will be fine. But no support for the actual victim, the survivor. And then fear of the community's fear of jeopardising their own positions, especially if the perpetrator is powerful or from a powerful family locally. They don't want to get involved. So again, beyond the individual barriers, we have many barriers at community level. We're beginning to understand why many of these cases get nowhere near the formal authorities. So local resolutions are arranged. Again, survivors are ignored. No justice is done. Abuse can continue. Now, when we talk to the professional services, especially the police, they equally expressed frustration that that the survivors and their families didn't want to take the cases to them, and they couldn't deal with them if they were not getting evidence from the survivors of the abuse. However, when we talk to other people like church leaders and so on, like this guy, a church leader, he said, I don't think the police have the right training for dealing with the victims, and at times they harass and question a disabled person as if they are the perpetrators rather than the victim, which traumatises and stigmatises them even more. And a doctor admitted that they do not have proper training specifically on sexual abuse. So one of the big barriers again is inadequate knowledge and poor practice amongst the service providers. The investigating officer, this is a senior police officer who told us very candidly, the investigating officer is sometimes bribed by the accused so that he makes a shoddy investigation which cannot sustain in a court of law. And let me tell you, this is very common. So we know that the police in East Africa and other places are subject to coercion and corruption. I'm just going to skip through this because I've covered these points. I want to get to this is an appeal to you and the larger community of people working in sexual violence. People with disabilities should be the first group that's included in policies and practices concerning sexual violence because they're more vulnerable. Do not exclude people with disabilities or just include them as an afterthought. And even when it comes to information, services, think about access, think about inclusion, think about inclusive access to information, inclusive access to information as well as services. Okay, so from this work, what have we done as a small NGO? We tried a few interventions. One is what we called a multi-sector community responsibility. So what we did was, in a certain location in eastern Kenya, we brought together all the local stakeholders from village level, like village elders, through to the formal authorities, and we provided them with awareness-raising training through a 4-day workshop, and formed like a community of knowledge and practice within that community that would respond better, we hoped, to incidents of abuse against disabled people and help prevent it happening. This actually worked very well. In the last 18 months, in that small community of Kibwezi in eastern Kenya, we've managed to prosecute 3 people through this group who are now working actively to support cases, and that was unheard of before we intervened. These things were just not being supported by the services. We've also created 1 or 2 resources, a simple what to do in the case of rape or sexual abuse booklet for families and friends, and some other printed resources. We've also developed a number of posters for advocacy and policy influencing, and we've also worked with a local drama group to devise dramas about the rights of women and girls and sexual violence, and that again is reaching quite a large number within the local context. I'd just like to make you aware that we are, as Advantage Africa, looking for partnerships to take this work forward and support of our work, and we're also very thankful to FIRA again for supporting the research that we've undertaken. And I've got that link printed out on some paper at the front here if you'd like to access the resources that we've come up with as part of the research. Thank you.
Thank you, Rob. So we'll move on. If you've got fewer questions, we will make it. So I'm going to